Hi, and thank you so much for popping by. My name is Vita Pobaluzwi. Feel free to call me Bui. In this clip, I'm going to talk a little bit about cervical cancer. As you might know, January is the month where we raise awareness on cervical cancer. And in this case, I'm going to support myself with a little bit of research to find out what is the status of cervical cancer globally, or what is the status of cervical cancer worldwide. Who is it affecting the most and why? So I'm still on the WHO page and I can see some information which is showing clear disparities, where you can see that 19 of the top 20 countries with the highest cervical cancer burden were in Sub-Saharan Africa in 2018. So in 2018, 19 of the top 20 countries with the highest cervical cancer burden were in Sub-Saharan Africa. Cervical cancer progresses slowly from the pre-cancer stage to invasive cancer, and it is entirely curable if diagnosed and treated early. The tragedy is that while this type of cancer is one of the most preventable, poor access to prevention, screening, and treatment contributes to 90% of the deaths that are associated to cervical cancer in Sub-Saharan Africa. Typically, it takes 15 to 20 years for abnormal cells to become cancer. But in women with weakened immune systems, such as untreated HIV, this process can be faster and take 5 to 10 years. That's one of the key things that is popping out from this article, is that women living with HIV are 6 times more likely to develop cervical cancer compared to women without HIV. Those are the disparities between the global north and the global south, right? And why more efforts are required in Sub-Saharan Africa so that they can deter the cases of cervical cancer. Women are at higher risk if they are HIV positive or have any other condition that makes it hard for the body to fight the disease or the illness, right? If this woman has multiple sexual partners or has sex with partners who themselves have multiple sexual partners or participate in high-risk sexual activity, that increases your risk, right? And I remember there used to be a term called sexual networks, knowing who is in your sexual network, right? Women who have not been vaccinated against HPV have a higher risk. Women who have a co-infection, including or involving other sexually transmitted agents such as herpes, chlamydia, or gonorrhea, right? So if you have any of those other sexually transmitted diseases, your risk will be higher for cervical cancer. Smoking, the risk increases according to how much they smoke and the age at which they started smoking, right? These are women. We're talking about women here. Women who have engaged in long-term use of oral contraceptives are also deemed to have a higher risk. And women who have not been screened for pre-cancer lesions are also at a higher risk for cervical cancer. So yes, please make sure that you share this information with anybody in your circle, whether it's a professional circle, your personal circle, whether your professional network or your personal network, your friends, your family, your sisters, your mom. Just give them a reminder to say, you know what, why don't you pop by that the hospital and get a test. And even for guys, right, you could be married or in a partner with a woman, and yes, so you can also serve as a reminder. You can also serve as a reminder, sir. Alrighty, my friend, thank you so much for popping by. I hope you're having a lovely day where you are, but most importantly, I hope you're having a healthy day wherever you're watching me from. Bye.